Okay, here we have Bernadette, and she came to us about 6 weeks ago, and she had some symptoms going down her left thigh, some hip pain, some knee issues. So at that time, we decided to do some laser cell signaling and some high dose platelet rich plasma to stimulate her V cells, very small, like embryonic stem cells, which are her own, which we stimulated with the laser technology. So 6 months late. So what were your symptoms like before the treatment, Bernadette, and what is it like now?
Okay, when I came, I had stem cell in my right hip with my own body stem cells prior about 3 years ago.
And did that work before?
Yeah, no, it worked pretty good. And then I had a follow-up because it wasn't progressing as well as one would like. And I had, at that time, there was an issue with stem cells legally. And
Yeah, with getting it from the fat. They didn't allow that. Yeah.
so they did not give me, I had banked my stem cells, but they couldn't give them to me. And so at that time, they gave me PRP, which
Yeah.
they took some fatty stuff out of my middle again. Anyway, that worked. I mean, it ended up what I considered working very well.
Yeah.
Except 3 years later, it recurred. That was only on my right hip. 3 years later, I've had issues with my hip, and it would go down my leg, and then I had issues on my left hip. So I had both of them. So I just thought I had heard about the umbilical placenta stem cells. So I thought, well, I'm going to give that a try and see what that does. So anyway, I guess at this point I have to, I just kind of thought I would be much more better by this time. Before I had a hard time in bed, turning over and stuff was always like, oh, wow. Hard to get turned over and stuff. That has improved. It's
Good.
not perfect by any means, but it has way improved. And the other issue I had was if I would stand up, it would be like I felt like I was an old lady, like I had to stand up and kind of get my balance. But I could always walk. I said, walking is no problem. I can walk. It's just like getting up and in bed and stuff. Anyway, the interesting thing is now that bed is better and actually getting up is better. But now I feel it in my groin when I walk, and especially on my right side. My left side, I feel a little bit of it clicks, or
Yeah.
you can kind of tell, like every now and then it'd be like, oh yeah, like some little adjusting thing is happening, in my hip on my left side. My right side, it's my groin. I'm just very aware of my groin when I walk, and I didn't used to be, and it makes me feel like I have to be careful.
Yeah, your body's adjusting now that you're more mobile. That's what's happening, going through some growing pains. So what about the left thigh, the symptoms you're getting down there?
My right thigh. It's yeah. What did you ask me a question?
You said you had some type of numbness down your left thigh before.
Yeah, it was always on my right.
Yeah.
If I said left, I made a mistake. It went down my
Yeah,
leg.
I think you drew in the left thigh by mistake. How was that? Those symptoms?
Oh yeah, I did draw it on my left. Sorry.
How are
So,
those symptoms?
on my right, yeah. My right side, which is, I made the mistake there, but my right side is, I can still feel it because sometimes it goes down, I can feel it down my leg. It's not awful, but I'm aware of
So
it. Like
percentage wise, how
when
much?
I'm in bed, when I'm in bed, like my right leg is the one that's more difficult to manipulate.
But compared to 6 weeks prior,
Right.
how much more percent improvements do you feel already?
Yeah, I put on my paper here today, probably at least 30, 40 or 40, 50 even.
Yeah, now considering that, remember my estimation was, maybe we could get about 10% improvement a month. Here we are, we're in after the first month, you're already 40, 50%. That's quite the improvement. And you've been doing your the light stim unit on your hip every day as well, right?
I did that like 3 times a day.
Good. That keeps
And
the
Melissa
cell,
told me I could do it 2 times, so now I'm doing
that
it 2
keeps
times.
it activated. So yeah, we'll just we're going to give you a booster treatment with the high powered laser today to reactivate the cells. Then we have you come back in a couple months for your 3 months follow up, but you're making great progress.
Well, I was gonna say, I wrote here in my paper that
Can you do one more thing? Could you show me your ability to get out of the chair easier and walk to the door and come back? I
Yeah,
just
I
want to
can
see your
get up.
mobility.
Can
Yeah,
you
go
see?
ahead.
Yeah, I can get up easily now.
Okay.
I mean,
Now,
that's,
could you kind of mimic getting out of the chair before we started the treatment when you had a bad day? Go ahead and sit down and kind of mimic as best. What would it be like? Go ahead.
I would have just like, just gotten up like this kind of, and kind of gotten my balance, or, kind of gotten my
Kind
balance.
of
a little
reset
bit.
yourself before you walk. Okay. All
So
right.
that has definitely improved.
Well,
And
I'm glad you're wearing my.
I'm concerned about is the groin thing, and I don't like that I feel.
Well,
this.
yeah, that's your body's way of it's adjusting now that you're more mobile. Okay.
Now, Melissa gave me, when I called her a couple of weeks ago, I have come in for 4 treatments, two week or 2 Wednesday,
Yeah, the
Friday.
booster treat. We're going to give you the 5th one today.
I
Okay.
don't have time to wait today, so I don't
And
think
you can schedule that next time, but
I'll do it.
you like the green and white. That's my college colors, Michigan State.
Yeah.
You're a Spartan fan. All right, I'm glad you're making progress. We'll see you in a couple months. Go and
Okay,
schedule your 5th laser treatment.